Okay, good evening, everyone, and welcome to the August 12th, 2021 impromptu meeting of the Needham Board of Health. I'm Rob Partridge, Board Chair. This open meeting of the Board of Health is being conducted remotely per the Governor's Executive Order of March 12, 2020 due to the COVID-19 pandemic and is being recorded. Public access is available, but public participation is not anticipated. I'll introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Kathleen Brown?
Yes.
Ed Cosgrove?
Yes.
Steve Epstein?
Yes.
Christina Matthews?
Yes.
And Tim McDonald?
Present. Yep.
Mary Fountain?
Yes.
Tara Gurge?
Yes.
Hannah Whitehead?
Yes.
And Tiffany Zeich?
Here.
Well, thank you for all attending tonight. We went from, excuse me, having 0 meetings in August to now 2, but we all felt it was important to have this meeting to discuss the current situation in Needham, given the recent increasing number of COVID cases in Massachusetts and Norfolk County, and also to sort of interpret this with the new CDC guide. First, we're going to start with a sort of a status overview.
Yep.
And I don't know if that's going to be from Tim or from Hannah.
I think a little bit of both, but I will share my screen. Kathleen and Rob, you were on a meeting earlier, and Hannah already updated some of the information with the state data that was released about 20 minutes ago, which we really appreciate. So let's start at the top. And so Hannah, if you can, maybe we'll go through the slides and I'll jump in when needed, but I'll have you take the lead.
Sure, sounds great. Okay, so just to start, just to overview our curve over the past year and a half now almost. So as you can see, after 3 cases in June, things have started ticking up. So this is just the number of confirmed cases each day. And you can see in the bottom right for August, bars are getting higher again. It's kind of the same thing, just looking at it in terms of our rolling 7-day average daily incidence. As of today, that would be 13.2 cases per day per 100,000, and we're up to a grand total of just over 1,800 confirmed cases. So this is looking at our incidence rate and percent positivity going back since March. So you can see we're kind of back up to where we were in like mid-April, in the middle of the spring, in terms of our incidence. Percent positivity is actually at the highest it's been since I started tracking this in March. So we're at 1.56% right now. And I've also updated our little table of our kind of surrounding towns and counties, which we haven't looked at in a while. These rates are increasing pretty much across the board throughout the state. And so our 2-week incidence rate put out by the state, which covers July 25th to August 7th. So there's a bit of a lag there. Is 9.5 cases per day per 100,000. And that's pretty much in line with what we're seeing in our kind of neighboring towns as well.
Just to add a little context, at sort of the worst point of the previous pandemic waves, which for Needham was mid-January 2021, our average daily incident rate hit a peak of 52.3 cases. And our positive testing rate hit a peak of 3.95%. So while we are certainly trending upward in concert with the rest of the surrounding communities and the state as a whole, we're not anywhere close to the peak that we had hit last January, which is a good thing. we'd certainly prefer to not get to those levels again.
Yeah, and I think another important distinction from kind of the peak we were seeing at the beginning of the year is kind of the age structure. As we know, since vaccinations rolled out, the cases in the over 65s have really declined. So this is just looking at our age breakdown. For looking at our cases from July and August, about 40% are under the age of 18 or 18 or under. And there were only a very small number of cases, less than 10% above the age of 65. And I also wanted to look at our average case age by month. So you can see, early on in the pandemic, it was much older. In April 2020, it was an average age of 73. So it's definitely skewing much younger now. Our average age so far for August is 27. And about a third of the cases we've had in August so far are in the 5 to 18-year-old age group. So obviously a big chunk of that are the under 12s who aren't vaccinated yet. So I think we all are very curious about what's going on with breakthrough cases. So we are able to now kind of dig into this data among our cases and kind of compare to their vaccination status. Mary, feel free to jump in here if you have anything to add. This was Mary's work digging through all of the cases we've had since May and tracking down their vaccination status. Still not reported in the most succinct way through the state system, but as you can see, so overall, since May, we've had 99 cases, and about half of those, or just over half, have been breakthrough cases. So we're considering that, like, if they have had either, one dose of J&J or 2 doses of the other vaccines, and then 2 weeks after their second dose, to be considered a breakthrough case. And then after the breakthrough cases, which is making up, a significant portion, is cases among ineligible children, primarily, who are too young to be vaccinated. So we're not seeing a lot of cases among unvaccinated because we don't have a lot of unvaccinated people. And we're not, I think earlier on when, it was still earlier on in the rollout of the vaccines, we were seeing more cases among partially vaccinated individuals, but it's not really the case anymore. I wanted to look just at our average age of the breakthrough cases. It's 42 years is the median. 75% of the breakthrough cases are falling in the range of 35 to 61 years. So kind of this mid-age group, I guess. And then on the right, this pie chart is just showing the breakdown just for July and August breakthrough cases, which vaccine they had. So 70% Pfizer. I would not interpret this as anything about the efficacy of the vaccines. I think this is primarily just reflective of which vaccines people have gotten.
Yeah, with just a tack add-on in there, if you just look at the totals column, I don't think it gives the full picture in terms of the change we've seen in July and August. So in May and June, the rate of how many, as I was more likely to talk to someone who was unvaccinated than someone who was vaccinated. In July and August, and I'm assuming this is partially, at least due to the influence of the Delta variant, essentially everybody I talk to is either too young to be vaccinated or is a vaccine breakthrough case. The cases that I've had that are unvaccinated are also lost to follow-up. I haven't been able to talk to those individuals and find out if they were vaccinated elsewhere. So these are just vaccines that I've been able to confirm either through MIIS or through talking to someone and having them provide their vaccination status. So right now, functionally, everybody is either too young to be vaccinated or a breakthrough case as far as my work shows.
And one of the things that Hannah referenced is because we are in the fortunate position as a community of having so many people vaccinated, it's not particularly surprising that we're seeing a large proportion of our total cases be cases in vaccinated individuals. I think what's probably important in context is to think about 51 breakthrough cases over a 3.5 month span. And if we look at the next slide, we're going to see the total fully vaccinated population of Needham at over 23,000. So just over 50 breakthrough cases out of 23,000 plus individuals that are fully vaccinated. It's still a very small number overall.
Yeah, I think it's actually on the previous slide. I think it's like 0.2% of everyone in the town who's been vaccinated for the May through August breakthrough cases. So yeah, it's a tiny, tiny percentage.
Do we know anything about the breakthrough cases, like in terms of symptoms? Are they people that went to get tested because they were symptomatic,
Yes.
or because they had to get a test for another reason, like travel?
The vast majority were symptomatic. They were all essentially, more or less, all mildly symptomatic. Of the people I've spoken to, 2 of them have been briefly inpatient, a couple of days, and then released to home. I haven't encountered any serious illness from the cases that I've spoken to. We now have a part-time contact tracer back on staff, thank goodness. And so I can no longer say that I've talked to everyone, but of the people I've talked to and the notes that she left that I've reviewed, I don't see any serious illness. I do see exacerbations of asthma being a primary issue in terms of hospitalizations or visits to the doctor. But while most of our cases are also at least half, right at half in July and half so far of my cases in August are related to travel, either somebody traveling into Needham and causing a family to get sick, or an entire family traveling elsewhere and acquiring COVID infection outside of the state or outside of town on the Cape or whatnot. I'm not seeing very many cases that test due to travel or testing for other asymptomatic reasons, unless someone else in the household is ill and then they get tested, but most of them are symptomatic.
Mary, you were saying that half are related to travel. What would you say the others are related to?
So I've got a couple of work exposures. I've got a handful of people who have literally no idea. I have a few who are, I do have a few that are facilities. So a few daycare and school and such, like teacher at a school or that sort of thing, that I haven't been able to pin down to being related to any kind of travel. So, but the majority are out of state or children coming back from summer camp out of state. I've had a handful of those also.
Mary, one of the things we were worried about in the winter was large clusters of cases or sustained chains of transmission. Are we seeing anything like that so far?
No, and I'm not actually even really seeing much household transmission, which is sort of the opposite of what it was this last winter. If we do have multiple positives in one household, it's because they were all at the same place. So they were all outside of the state together, or they were all at a funeral together, or that sort of thing, exposed at the same time, and then they all come up positive. But otherwise, for the most part, people are, someone will catch it at school and they'll bring it home. And I'm not seeing as much household transmission at all. And then I'm not really seeing much evidence either of community transmission. I'm seeing, for the most part, individuals are coming home or having someone come visit them in their home, and just that household is getting sick. I do have, finally, it looks like one child passed it to a child in another family. And that's the first time I've seen that since, I think, April or May. So it's much less common actually than what we were seeing before. And I think a lot of that is because most of these households are vaccinated. So as soon as they get the idea that someone is not feeling well, then the households tend to kind of separate themselves out, and then nobody else in the household seems to be getting it. So
That's important. You mentioned vaccination rates in Needham, or the fact that most people are vaccinated, and that's probably a good jumping off point to our next slide. This is always one of my favorite slides.
Yeah, a great slide showing our progress. I was actually excited to see the numbers come out today. We officially hit 80% fully vaccinated. We'd been hovering at 78%, 79% since the beginning of July, I think. And then that, of course, most of the remaining 20% are under the age of 12, about 16%. So we have over 25,000 with at least one dose, 23,300 fully vaccinated. The number of partially vaccinated is starting to tick back down a bit. It's kind of had been hovering. So it's looking like maybe people who had been putting off their second dose are now going in for that. On the right, you can see kind of the fully versus partially vaccinated by age group. So there is still kind of these like lingering couple of hundred in each age group who don't seem to have gotten their second doses. And on the next slide, I've looked at that a bit more closely with teenagers. So this slide's looking at vaccination among youth. So we have the 12 to 15-year-old age group, which is now at 86% fully vaccinated. 16 to 19-year-olds are at 90%. As of today's numbers, every age group except for the 12 to 15 is now at 90% fully vaccinated or higher. And at the rate it's been climbing, 12 to 15-year-olds will probably hit that, I would assume, in the next week or two. I think we talked about it at the last meeting. I've been looking into the number of missed second doses. So looking back at, tracking 4 weeks back and seeing if everyone who had gotten their first dose has gotten their second. So currently we seem to have about 380 missed second doses among the 12 to 15-year-olds and 170 approximately among the 16 to 19-year-olds. That number for the 12 to 15-year-olds has been kind of dropping pretty steadily over the last few weeks. So they seem to be catching up. The 16 to 19-year-olds, that number has stayed pretty constant for the past month or so.
Do we know if that's a data thing? Like, I thought there were some providers maybe not reporting as
much. I think Tiffany had tried digging into that with some of her sources, and we haven't really gotten a clear sense of that yet.
I touched base with a few of the pharmacies I know that were doing youth, and they've all said they've turned in their data. So they said they'll double check and make sure they didn't have any crossed issues and get back to me if they did. But for now, everyone's saying, so it's got to be some kind of lag or some issue with the state.
Yeah, I also don't know. I guess if people are getting their second doses in a different state, then that probably doesn't get picked up. Especially in the 16 to 19-year-olds. I don't know if people are going back to college, that kind of thing, or away somewhere else for the summer. That could possibly be contributing to some of that. So then the next couple of graphs are just looking at a more of a macro level scale at hospitalizations and deaths. So this is state level trends. As we can see, hospitalizations in the bottom right, they're ticking up slightly, but not nearly with the same velocity that cases have been ticking up. There seems to always be like each week this kind of dip. I think that gets smoothed out in the next week of averaging out the data. So I wouldn't read into that too much, but I mean, they are climbing, but as you'll see on the next slide, deaths really haven't been at all. So this is zooming into Norfolk County. You can see cases kind of sharply increasing, but deaths really still remaining far below, 1 per day, and continue to kind of trend down and stay flat. So that's promising. Needham specifically, we haven't had a COVID death since mid-April. So that's very promising.
The data we've been looking at up to this point has been the sort of state level data. I think as folks know, the CDC released recommendations, I guess it probably was 4 weeks ago, 3 or 4 weeks ago right now, talking about communities where there is substantial or high rates of transmission of COVID, recommending that those places require masking regardless of vaccination status. So the next couple slides that Hannah's going to talk about present sort of the CDC data, which we have only started looking at in the period after which CDC came out with those recommendations.
Sorry, it's on mute. Yeah, as we've talked about before, the CDC is kind of calculating they're using different metrics. So they're looking at cases in terms of total cases over a week period, and then also the percent positivity. And they look at those two indicators and by county, and they go with whatever the higher of the two is. So you can see I've circled in red, our percent positivity remains in the low transmission category, but we fell into substantial transmission based on our total number of cases per 100,000. And so this is from August 4th to 10th. This is up a bit from the last time I pulled this data about a week ago, but we remain in the substantial. We haven't moved towards high. And then in the next slide, the CDC has this great GIF, I guess, just showing the time lapse over a month period. So this is from July 11th to August 10th. You can see everything slowly turning orange, a lot of red, indicating high transmission around us. Norfolk County remains substantial for now, but we'll keep an eye on this moving forward. And their guidelines in terms of masking, depend on what level you've been placed at.
One of the challenges, I think, with the CDC guidelines, and we'll probably talk about them a little bit more, is it's a fairly static indicator, right? So that the guidance is based solely on that transmission number and doesn't take into account a community's vaccination level, so that the CDC is sort of proposing the same level of intervention for a county, maybe in Florida, that has a 42% vaccination rate, or a place like Needham, where we just went over the fact that 80% of the town is fully vaccinated. So from our perspective, in some ways, it's a limited measure, that it doesn't account for the fact that we have a very, very high vaccination rate in the community. I will stop sharing my screen. Thank you, Hannah, for presenting, and open up for questions from the board. We can certainly pull it back up if you want to go to a particular slide. If the board doesn't have any specific questions about the presentation, I think the last sort of topic is one that we want to maybe start with the discussion. So some communities in Massachusetts, a small number so far, have followed through with the CDC recommendation and have required masking in all indoor settings. Nantucket and Provincetown did that. They both have a very high number of seasonal visitors, tourists. Belmont did that earlier this week, and Salem as well. And I think Somerville is considering that. It's something the board, we probably should talk about as a group. There's also the matter, and it's something that's being worked on. I know that the Joint Health and Safety Committee met earlier today, and both Kathleen and Rob were present along with myself. to help support and advise the superintendent about a policy for the fall regarding masks and looking at other sort of defense measures and interventions in terms of reducing the chance of COVID infection. So a lot of topics were covered at that meeting, including potentially symptomatic testing of individuals that present with symptoms, potentially possible surveillance level testing, and looking at some of the measures that were put in place last year in terms of cleaning frequency, use of masks, air handling and ventilation. So that's
Were any decisions made at that meeting?
No final decisions were made. I think, Rob's perspective, he put it in an email to a number of folks last week. Same thing with Dr. Stern, was to follow, their recommendation was to follow the Mass Medical Society, the American Academy of Pediatrics, who have all come out in favor of masking in educational settings, regardless of vaccination status.
For K through 12.
Sorry, yes, for K through 12. Although we know that a number of, from recent headlines, we know a number of colleges have reassessed their mask requirements or reassessed their testing requirements in recent weeks.
And is the state still offering surveillance testing, that option?
The state is offering a couple different options, which I think one of the things that's potentially very nice about what the Department of Elementary and Secondary Education presented yesterday, actually, is that there were sort of three different options, and there was the ability to implement them later or move between them if your situation warranted. So it did provide some flexibility. I think one thing that I want the board to be aware of is, and Kathleen knows this far better than I do, but when you're talking about a community with a very high vaccination rate and a low case rate, the percent of false positives would be expected to outnumber the actual true positives. I think Kathleen, you had cited potentially by 4 or 5 to 1.
That's what I've seen published, yeah. So that the risk of that is that you isolate or quarantine people who aren't really cases.
So I think, one of the big questions for the board is what are its thoughts about indoor masking right now in settings like town, the post office, the coffee shop, town buildings. Right now, it's not required. It is, of course, requested for anyone who's not vaccinated, and it is recommended for people who are in high-risk groups, although we could certainly do more to publish that message that people who are in high-risk groups themselves or have a family or loved one who's in a high-risk group, such as being immunocompromised, those folks are strongly recommended to wear masks indoors.
So I'll throw out a straw man here. All right. I'd like to see us get some some signage out to stores with some sort of statement. I'll throw out as the straw man here that the Board of Health recommends the use of masks indoors, regardless of vaccination status. I do not think that we should require it. I think that the most serious thing here is, hospitalization and death. I think the vaccines are working. And I do not see a reason to require that. I mean, frankly, the rate is less than hospitalizations from flu from what I'm seeing from this data.
Correct.
Now, I think that's very different when we talk about K through 6 in our town, and I would exclude the middle school and high school. I mean, I'm really looking at the under 12 population. There, yes, I think we would want to have a requirement in areas where children are present. I'm not sure the best way to do that because I've been thinking about whether or not municipal buildings, because children may come in and it does serve the public, whether or not we should be requiring masking in municipal buildings. I don't know if that's just a step too far, but certainly in the schools, I would strongly urge us to formally recommend to the school committee that masking is mandatory at least K through 12. K through 6.
think that probably aligns with what a lot of people recommend, because while the staff may be vaccinated, none of the student body would be in K through 6. I don't actually think that's controversial. I believe the superintendent and the school committee, and certainly the Joint Health and Safety Committee, were all supportive of that. I think there was some disagreement about the 7 to 12 because we do have a very high vaccination rate of students in grades 7 through 12. And obviously we do have a high staff vaccination rate as well. One of the things that, and I don't want to conflate them, but one of the things, and it was a point that Mary brought up, which I thought was very well articulated, is the overall goal is to maximize the health and safety of the staff and the students. But the secondary goal has got to be to maximize the time in learning for students. Currently, the requirements for quarantine for a close contact of someone with COVID is that if you are symptomatic in any way, if you have the sniffles, if you have a cough, you are required to quarantine for the full 14 days. There's no option to test out of it. We do know that masks last year helped reduce the flu season to very negligible amount, helped reduce the spread of common cold. And at least to us, it seems like that's a potential worthwhile strategy so that we don't have, students that are quarantining for 14 days because they happen to have the sniffles when one of their classmates also had COVID. We don't want them to sort of be collateral caught up in the quarantine results because they have something that has a symptom that's like COVID. So to me, that's one of the strong arguments potentially for the masking in the grade 7 to 12, even though a lot of the students are vaccinated and the staff are vaccinated.
If I may, also, we don't anticipate that the quarantine order is going to last forever. Katie Brown mentions in almost every Tuesday the DPH call that contact tracing is not the long-term solution. Quarantine is not the long-term solution. And so when I was mentioning this to Tim, my suggestion was that while we have this quarantine order, doing what we can to limit how long children are in quarantine I thought would be a way to keep kids in school as long as possible. I hate the idea that even if you're fully vaccinated, if you have symptoms, you have to quarantine. And the rule as written is that if you're symptomatic, it is 14 days of quarantine. There isn't a change to the quarantine rule that if you're fully vaccinated and symptomatic, you can get out in 7 days. So the rule is written. I've asked the state for clarification. If you're fully vaccinated and become symptomatic and thus have to quarantine, if it is the flat 14 days, and I haven't had that clarified yet, there isn't an exception to the quarantine rules in that sense. And so that means in the high school, if someone's exposed and they get the sniffles 3 days later and therefore have to quarantine, it's 14 days from the exposure date.
Even with a negative test?
The quarantine says that if you have any symptoms, regardless of whether or not you test, it's a 14-day quarantine.
I may be wrong, but I thought that and Tim and Kathleen, correct me, the document that we looked at the end of our meeting just an hour ago, it looked like you could test out on day 8 to go back on day 11.
If you don't have symptoms. That is specifically that the two qualifications for an 8-day quarantine is asymptomatic and a negative test.
So there are test out options specifically for people who don't have symptoms, which is important. And I think that's helpful to reduce quarantine times. I think the challenge is when you have someone who has an unrelated, very mild illness getting caught up in sort of the 14-day COVID quarantine because they happen to have a cough or, runny nose or something that aligned with COVID. And that's a unfortunate collateral consequence that we would like to try to avoid wherever possible.
At least for as long as there's a quarantine
for
order.
how we would avoid that, Tim?
I think masking cut. I mean, the flu numbers last flu season were negligible, right? I don't know them off the top of my head, but both you and Rob, as practicing emergency physicians, I don't think you saw much in the way of flu patients in the ED last year. Masks worked to reduce the spread of flu and the common cold. And I guess the hope would be that if you employed them again, there would be very little sort of common cold circulating.
Maybe. I'll just say, yeah, I don't want to put in an indoor mask mandate in our town. I think the plan we have currently, we have a very high vaccination rate, is sufficient. Brushing by someone in a grocery store is very different than being in a crowded nightclub with 100 people in an outbreak. So that's sort of my quick take.
Steve had talked about a strong recommendation that people mask indoors. What does the board think about that? I personally think it's appropriate. I think one of the things we've been trying to get across to the public is to sort of understand your own personal risk level and whether, you are comfortable with this, with going out to the supermarket without a mask, or if you want to have a mask in a supermarket, may depend on whether your spouse is recovering from cancer or you have a child who is under 12. So people sort of have to do their own risk assessment of what they are comfortable with and take decisions within that framework.
I think it's very reasonable to have a strong recommendation. I've certainly noticed that since the CDC guidance came out, that when I'm in town, I see people when they walk into stores and other settings, a lot of them will put a mask on.
Is there a way that we could make such a recommendation flexible? Because obviously, or we're just going to have to make it short term, because boy, the public is going to get confused if we put this in now, we take it out in a month, and then it goes back into effect to 3 weeks later, based on a CDC number, right?
Yeah, which I think, begs the question of, do we follow a CDC number, or is it more sort of our own determination based on our case volume and the testing rate around Needham, informed by CDC, but not particularly dictated by that?
I think informed by, they have said for areas of substantial transmission, and if we were to become low transmission again, when we do, we may change the guidance again. But, I think people are learning that this is a very dynamic pandemic, and there's going to be changes that come not infrequently as we learn more.
It's just at the same time, I think that, we feel that vaccinations work. And, this is why I struggle with the going back to masks issues, because this is like flu at this point for those who are vaccinated. I think we need to, protect those who cannot get vaccinated. People who choose not to get vaccinated, that's a whole nother can of worms. But that's generally not the case in our town. So I don't want to see a huge burden on the vast majority of our population that has been vaccinated. But if there's, kind of a modest approach where they can help, particularly where there are children present, I think that's pretty reasonable.
Right. I keep thinking too that, 16% of the town's population is under 12. So that's a pretty large proportion of the town. And so I don't think we need an indoor mask mandate at this point, but I would support some, advisory or a recommendation that people do mask. It seems as though a lot of establishments already have put up some signage that, and they'll say, the CDC recommends. So we could kind of, maybe wait a couple of weeks and, wait and see how things go and leave things as they are. But I do think, we have to do what we can to protect that 16% too.
Yes. Certainly one of the things we could do is work with the Town of Needham's Public Information Officer, Cindy Gonzalez, and the Economic Development Manager, Amy, and I'm having a brain lapse because I don't remember Amy's last name off the top of my head, but we could work with Amy and Cindy to sort of test out a couple of messages and flyers with some of the business community. I know that they have concerns about having to sort of referee between people who, if there's a mask requirement and then someone doesn't have a mask on, what's their sort of burden? So working with them to figure out a way to word the recommendation in such a way that they feel it's helping them keep their business safe would be important.
which kind of brings us back to the state guidance, right? Which is, review your risk factors and mask accordingly. Protect your family or yourself. It's kind of what's in place.
And that is an important message, and it seems a simple enough message, but it probably doesn't lend itself to a nice infographic that easily. So we'll have to do some thinking about ways we can message that.
Yeah, it'll be important, with recommend versus strongly recommend versus encourage. I mean, we can play with the semantics a bit, but I think it would be helpful if we have available, at least to businesses, some signage that they can put up to that effect with our name on it, because we agree with that. That gets them out of the middle of refereeing. I agree they should not have to referee this at all. But if we can get the message out that this is a good idea, and remind people when they go into stores that maybe you ought to put that mask on. I think would be perhaps the most appropriate way to do it. But the wording I think will matter to some degree, and I agree we should kind of test that out. Strongly, not strongly. How I'm not sure how other people feel about that. Looks like we have some questions in the Q&A as well.
Yes, normally we don't actually have a Q&A. I don't know the settings I did. I do think as the board knows, but partially to answer maybe the questions in the Q&A, the board is meeting tonight and also meeting again on Tuesday night. And I think one of the things that's helpful for me to think about is the first slide, maybe that was shown in Hannah's presentation, which was the total cases and sort of where the peaks were. And we are not at the top of a peak. We're not approaching the top of a peak. There is still time for the board to gather information and to, it does not have to ban masks or require masks either way right now. It can always gather more information and make a more informed decision in a couple days or in a week. It does seem that the board has a fairly strong consensus that it would like to recommend or encourage masks and work with the business community on how to word that. But it doesn't seem like it's in a position right now to want to require masks in indoor settings, with the exception that Steve noted for K through 6 settings or the people that are ineligible to be vaccinated right now.
Right.
Yeah.
I just don't know if that needs to extend to municipal buildings that might be serving, where kids might be going in, because it is a government function.
So that's a good point. Certainly this building, the Rosemary Recreation Complex, does host a number of park and rec programs. And I think that's a good question.
At our last meeting, I thought that we did recommend that K through 12 be masked indoors.
K through 6.
We didn't. It was just K through 6.
Mm-hmm. Mm-hmm.
I mean, my thoughts about that are just that, like grade 7 through 12 don't, live in isolation. They live with those K through 6 kids. So my feeling would be more K through 12, to recommend that rather than just K through 6.
I know that, so the way that Dan uses the Joint Health and Safety Committee is to sort of give him a recommendation that he will then present to the school committee. And the school committee is usually the one that votes on, requiring masks or requiring spacing and distancing. I personally sent the superintendent my thoughts on indoor masks in school settings, which was that I was strongly in favor of them for K to 6 and for 7 to 12. I think what the superintendent is thinking about, it's something that Steve and other board members have said tonight, is that we have such a high vaccination rate. And there's value in having that high vaccination rate. We worked hard to get that vaccination rate. People acted responsibly to help get us that vaccination rate. And he would like, a process or a timeline by which the indoor masking for 7 to 12 might be reconsidered or periodically reviewed to see whether it's necessary. That's not to say it would immediately be changed, but it's not saying we're going to do it for the entire academic year. It's saying we're going to do it for a month or a month and a half and then see where we are. Kathleen noted that, when we thought about the 2020-2021 academic year, there was sort of a spike that happened, late August into September and October. There was kind of a lull that happened for about a month or 5 weeks, and then post Thanksgiving, there was sort of a spike that really took off and culminated in mid-January. So I think the superintendent doesn't want to sort of say we're going to only do it for a month and then we're going to take it away. He really would like a process that evaluates it, but he did not want to make a commitment to a year-long mask requirement for the 7 to 12.
I mean, I think the best reason to consider 7 to 12 is the quarantine issue that you and Mary outlined. But I would almost leave that to the discretion of the school committee, right? I'm not worried. I mean, again, I think our responsibility is to make sure those kids don't get sick, and grades 7 through 12 are not going to get sick because they're vaccinated. So then it's a matter of, do you want them in school, and how are you doing hybrid learning if they're, if you have to quarantine them and all of that. I think we can certainly give them information about what it means if they have it and the pros and cons of masking, but ultimately I almost think that can go to the school committee, because I think we've done our job by making sure that the kids are safe by having such a high vaccination rate.
Sure, and I think there is still more work to do. There's the hope that sometime this fall, the emergency youth authorization for the Pfizer vaccine and potentially the Moderna vaccine will be extended to younger populations. There's no guarantee of that, and there's no specific timeline, but that certainly is the hope that might happen sometime in the next 3 months or 4 months. And that would be very significant if kids 5 and older or kids 2 and older were eligible for vaccination. That would go a long way, I think, to addressing a lot of concerns that parents and residents have.
I guess also to the point of the grades 7 to 12, even though they're very well vaccinated, the Delta agent is very contagious, and there are probably many people that get it and may transmit it without getting sick at all, so never get tested. And those are the people that would go home and unwittingly transmit it to siblings or adults at home that are immunocompromised. So that's just an important factor to consider for that age group.
That's true. I did want to respond potentially to one of the questions in the chat. The board actually met 2 weeks ago, less than 2 weeks ago, in person with health department staff. The reason that we're meeting virtually right now is because this was a meeting that was called suddenly, and not all members of staff and the board were in town for the meeting. But the board has met in person and anticipates continuing to meet in person with a hybrid option, so that it can be recorded and on Zoom so that people can watch it, because we think that does make it easier for residents to see the board and its deliberations. So I think that might answer one of the questions we had. One of the things that Steve had mentioned, potential masking in municipal buildings, and I think especially in the context of buildings that host youth programs, that's important. I think the town is hoping to work with its employees on some specific safety measures, less in terms of masking all staff, but in terms of assuring sort of workforce cohesion and basically force readiness, for lack of a better word. During the height of the pandemic, the Department of Public Works, for example, went to an A/B shift. So they kept, if the water treatment plant had 4 operators, only 2 of them would work together at a given time, and they'd, sort of separate so that if one group got COVID, the other group could still be there to make sure that the water was safe and running. I think the hope is that there are a couple sort of steps before that A/B shift concept that the town can employ to keep employees safe. We don't have numbers on total employee vaccinations, although we know that a number of employees registered for town vaccination clinics and took advantage when we did offer vaccine.
I think that is an important point to consider, these municipal buildings that children are using. Other than Park and Rec, what other, Rosemary, I guess, too, gets used.
The library
Yeah,
has some programs in the children's room,
Yeah.
although they've had essentially reduced capacity. They've haven't had as crowded programs as they might normally.
Mhm.
They've been limiting some slots in their programs, but they've still been having them.
I don't actually know if the library has any signage about masking. Do you know? That's pretty.
Off the top of my
I
head.
think as school begins, that is a place where children congregate, families congregate.
Yep.
So maybe that piece is probably something we should think further about, making some sort of considering, see how things go. We have a meeting next week too, but considering something for municipal buildings.
Yes. I don't know if there's particular points of information or additional data that the board would like us to gather for Tuesday. There's not a whole heck of a lot of time before Tuesday. It'll be a regular board meeting, so it will include other topics, including monthly reports. But if there's particular questions the board had, for example, one of the things I have not yet asked my team, but what percentage of our cases in July and August were in individuals under 12 years old. I know Mary had given me the stat for August that 11 out of the 33 cases were in those under 12, but it would just be interesting to understand that. I don't know if there's other pieces of information that the board thinks would be helpful for its discussion.
I guess just so we can understand the different buildings that may have, municipal buildings that may have kids present. We've come up with a couple, we may be missing one or two. That may help drive our guidance.
Additional information also on hospitalizations. I understand that they were brief, but what age groups might be at risk? There may be so few right now that we really can't get a sense of that, but if there's a particular population, that is an outcome of interest.
Absolutely. I mean, one of the things that we're hoping, and Steve, you referenced it as, hospitalization rate lower than the flu right now. Previous waves of COVID, the cases have gone up, and then at a comparable slope, hospitalizations have gone up, and at a comparable slope, deaths have gone up. With the highly vaccinated population, the hope is that hospitalizations and deaths are decoupled from cases. That cases might go up, and they might go up substantially, but that very few people will be hospitalized, and even fewer will die. And that does start to look a lot more like a typical flu season, potentially.
Exactly, but even for flu, there are high-risk groups for flu. We know who those are, and we want to do what we can to protect them. So if we can identify, who are high-risk groups, even amongst our vaccinated for COVID, it would be useful information, perhaps.
Absolutely. Okay. Great. Anything else?
Oh, and Tim, I was going to say, if you have a chance to discuss with the PIO regarding that messaging, maybe we could have a chance to review it. If anything's done by then.
Well, we have tomorrow and we have Monday, so we'll see what.
Oh, that's right.
We can make some progress though. I don't know if we can have final art. We do have a contracted graphics designer, but I don't know. We haven't given her the heads up that we need her to do something yet. But we could have certainly some text ideas.
Mm-hmm.
We just might not have the artwork yet.
Mm-hmm.
Do that. Yeah, Cindy has been very helpful, and we're really fortunate to have her. I did want to let the board know that during its meeting on Tuesday, there's also a select board meeting where they've asked Tiffany and I to present briefly about COVID. At that meeting, the select board will also take up a recommendation from the town manager, which was informed by a letter that Rob and Christina wrote, and then a follow-up memo that I sent outlining the potential resource needs for the health division as it responds to COVID, including funding for staff, contact tracers, and I think we've mentioned it before, I'm not positive, but Hannah Whitehead, who's been incredibly helpful, serving as our epi and our data visualization person, is departing. We got a grant to pay for her position. The town is going to put in for Recovery Act funds to hire another person to fulfill that important function. Hannah does in addition to helping make sure we have presentations that have great data and look visually appealing, she also maintains a lot of the COVID website and the dashboard, which I think is really helpful, and it's a good source of information for the public, and we don't want that function to fall away.
Hannah, will you be at our next meeting?
Next week, yeah,
Oh.
I think so. I'm on through the end of the month.
Okay.
But I was pleased that the town manager is going to recommend. So the select board is, for Recovery Act funds, is considering a process to engage public input and community feedback on priorities that the town should use. The select board did vote to essentially exempt from that process pressing health needs. So they're not going to, subject the health needs to a months long community feedback process. If the health division says it needs some resources to help meet the needs of COVID, then the select board feels it can vote on that. So the town manager is going to put forth a motion next Tuesday for the select board's consideration to fund those priorities that I mentioned. So that's great.
That's great.
I think there's other priorities, Christina, that you had mentioned specifically in the area of youth mental health, senior programming, senior isolation and depression, that they also are going to take up, although not this week. So I know that those are still priorities, and those were both funding priorities and priorities that you had included in a letter to the select board about some of the issues that they should have as their community level priorities, community level goals.
What does that mean, though, that they're not going to take it up this week? Does it mean that?
I don't know the timeline. I don't know if it's going to be, I just know they basically said we can vote on this thing right away. Other ones might take a little bit longer. I don't necessarily think that means they're going to take months. I just think it wasn't, it might take weeks more. So.
Okay. Well, that's good news.
It's very good news, I think. Yeah. We also, and we haven't really talked about it, but Tiffany authored a application for a state grant, a regional grant, shared with the towns of Dover and Medfield for contact tracing and case investigation. The state is going to be phasing out the contact tracing collaborative. And so Needham was awarded a grant, a multi-year grant to essentially replicate that function for the towns of Needham, Dover, and Medfield. We're still hoping to hear about a potential shared services grant with those communities in the environmental health area, but we haven't heard that yet.
Great.
So we like getting money. It's always a good thing.
That's great.
On Tuesday.
If the board doesn't have any other questions, we'll try to track down some of those answers. The board meeting is scheduled for 6 p.m. On Tuesday evening. Because some of the board members are traveling and some of the staff are traveling for vacations, it is a remote meeting, but it'll be on Zoom and it'll be recorded and also posted on the town's YouTube page.
When's our September meeting? Is that
Our September meeting is the 23rd.
23rd? Okay.
Get
a space to do that in person?
I haven't gotten to it yet, but I will.
Okay, but we can think about it. Okay.
No, we definitely had it scheduled in person. I just haven't booked the room yet. So.
Okay, cool. Thank you.
Okay. Other thoughts, comments? Great. Well, I guess we need a motion to adjourn.
So moved.
Make a motion to adjourn.
And second,
Second.
all in favor, Ed? Kathleen?
Yes.
Yes.
Christina?
Yes.
Steve?
Yes.
And Rob is yes. All right. Thank you so much, everybody. Appreciate your willingness to attend this impromptu meeting.
Thank you.
Great.
Have a good night.
Thanks. See you guys.
Thanks, we'll see you.
Night.